Excellent. So welcome everyone to ICORD's Knowledge Cafe, what citizen science can do for snail-borne disease control, lessons learned from Uganda. For those of you who are unfamiliar with the ICORD's Knowledge Cafe series, this is a series that we do on a monthly basis. It's open for anyone to present. We want to hear unpublished, published work, novel ideas, questions that you may have that you want to bring to the community. It's an opportunity for us to learn from each other. They're meant to be relatively informal. So we usually have about 25 to 30 minutes of a presentation, and then we'll have some time for discussion at the end. So as you listen today, if you have an idea, please don't hesitate to email us at icords@gmail.com and send us your ideas. I'll post the email in the chat box. So today we're really lucky to have Mercy and Maxson with us, who are going to share their journey of implementing a citizen science initiative in Uganda to address snail-borne diseases with endemic communities along the shore of Lake Albert. And I heard a similar presentation at the ASTMH, excuse me, in Chicago, and was just fascinated. So I'm really excited to hear their presentation today. They'll be highlighting the successes, challenges, and transformative potential of citizen involvement in combating snail-borne illnesses. And I know that's one of the things that we want to see more of in the NTD community is how to engage communities more. And so I think this is going to be a really interesting and novel approach. So Mercy is a PhD student at KU Leuven and is also affiliated with the Royal Museum for Central Africa in Belgium. She has a strong background in introductory and applied biological science disciplines and human environment interactions. And Maxson just recently completed his double PhD degree at the Mbara University of Science and Technology in Uganda and the University of Antwerp in Belgium. And he recently defended, so congratulations, Maxson, on that. It's no small feat. So Dr. Maxson is a seasoned and effective results-oriented sociologist with a background in a Bachelor of Arts in Social Science and Sociology. So we're delighted to have them both with us today. And I know we'll have a very interesting discussion ahead of us. So I would appreciate, for those of you in the room, if you could just maybe put in the chat box where you're calling in from today, so that we can kind of get an idea of who's on the call. And without further ado, I will pass over to Mercy and Maxson, who will lead us in the discussion today. And please feel free to, as questions arise, please feel free to type them into the chat box, and we will have some time, obviously, for good discussion at the end. So Mercy, I'll pass over to you, and welcome.
Thank you very much, Alison. I will share my screen now, and let me know if you can all see the screen, our slides.
That looks great. Yeah, just click that and we're ready to go. Well done. Thank you.
All right. So good morning, good afternoon, and good evening, all the listeners. It's a pleasure for Mercy and I to have this opportunity to present in this wonderful Knowledge Cafe session. It's also a pleasure for us to really be attended to by brilliant brains around the world. We are here today to share with you our journey about the citizen science and snail-borne disease in the global south, and specifically in Uganda. We'd like to share with you the lessons learned, what you've done with citizen science in the control and prevention of schistosomiasis as one of the snail-borne diseases. And also would like to share with you, first of all, what maybe the citizen science is and what snail-borne disease is, and then how we apply the citizen science in snail control, but also in community engagement. I would like to invite Mercy to start over from there. Mercy, you're welcome.
Thank you. So to start with, I'm just trying to see if I can.
Sí, sí, claro. Lo que pasa es que eso, que antes de que les llegue la convocatoria, quiero
Okay, great. So to start with, our work is actually on snail-borne diseases with a focus on schistosomiasis, otherwise called bilharzia or snail fever, and this affects globally 200 million people, but 90% of this occurs in sub-Saharan Africa. So now, schistosomiasis damages the liver and bladder, but it also causes infertility if untreated and stunted growth among children. There is a good treatment, drug called paracetamol, but because there is no vaccine, reinfection occurs once people are in contact with contaminated water, as you can see in this image, where we have the snail, which is an intermediate host of schistosoma parasites. So the snails release the worms into the water, and these worms get into the human body through the skin. They mature there, and the eggs are released back into the water through urination or defecation. And so there is reinfection each time people get in contact with contaminated water. Now, the World Health Organization has recommended that besides preventive chemotherapy, there needs to be focus on breaking the transmission cycle, which would mean we could, for example, have localized snail control, but also we could have behavior change to prevent people from indulging in risky water practices like you've seen in this image. Which is why, so we need, if we want to have snail control, first of all, we need a lot of data. There is no data on where the distribution of the snails in particular, and that's a big problem, but also the current interventions are top-down, and what we realize is that there is short-lived results, apart from the fact that we also have a few snail experts in places like Uganda. So this actually limits the current recommendations by the World Health Organization. Which is why the ATRAP project was born. ATRAP is an acronym for Action Towards Reducing Snail-borne Diseases. It was launched in 2019 and has been running until the end of last year with several partners, both from Belgium, from Uganda, as well as Congo, and supported by the Belgian Government Cooperation Fund. And how do we do it in ATRAP? I think the backbone for ATRAP it's important to say that it's citizen science. And most of you might be wondering, what is citizen science? In simple terms, it's typically an approach where you involve the local communities or members of the general public in doing scientific work. And they can be involved in different ways. For instance, data collection, which is where most citizen science activities fall, but also data analysis, as well as dissemination of research findings. So in ATRAP, we have set up a network of community members in Uganda as well as in Congo. We have 25 community members in each of these countries to do two main things. The first thing is to monitor snail distribution. This way we can come up with risk maps, and this will be important for targeted snail control, like the World Health Organization recommends. The second important objective in ATRAP is that we involve the community members or the citizen scientists, as we see them here, in community outreach to raise awareness about schistosomiasis. In that way, we hope to induce behavior change. But today our focus, the discussion will be totally about Uganda. And so just to give you a quick overview of what ATRAP is doing in Uganda, we have 25 community members, also called citizen scientists, and these monitor 76 pre-selected water contact sites along the shores of the southern part of Lake Albert. But also we have sites that are selected 40 kilometers upland. That's important. So we have people going to monitor these sites. Each citizen scientist was allocated sites that are closer to their residence, and they could have between 2 to 4 sites that they monitor. So the big question that probably you're also asking yourself, what can citizen science do for snail-borne diseases? Well, what we have done is we identified the 25 community members together with local leaders. So that was very important for ATRAP, to identify the people to participate in this initiative. And what we did was to equip them with equipment so that they could collect data on snail distribution. We gave them protective gear that involves gloves, gumboots. We also gave them a snail scoop, because if some of you may be aware that studying snail distribution requires a standardized way to collect the data, which is a snail scoop. They got a smartphone because they needed to collect the data, but also they got a snail ID to identify which snail they would have found in their contact areas. And with this, they also reported risky water practices that they saw in the places where they collected the data. And so after they collected the snails, they had to scoop for a certain amount of time. They'll put the snails on a graph paper, take a picture, and upload this information over a server, which is a Scopo Toolbox. It's an open source application. So they would send this data, and it would be received by what we call an expert, but a PhD student would receive all of this data. One question that is very prevalent in the citizen science field is if we can trust data collected by community members, because ideally most of these community members are not trained biologists, if you like. So the big question is their data reliable? That's also a question we had in the ATRAP team. And so what we did is to validate the data. There are several ways. There were several layers to validate this data. The first layer was automatic validation, whereby they had to scoop for a given period. So between 20 minutes and 40 minutes, every report that was outside this scope was already flagged as a mistake. But also the GPS location was very important, because they had been allocated pre-selected positions. So they had to have the correct location. And sometimes people who have been to Uganda might know that Facebook is banned. And so people have to install a VPN to be able to access Facebook. So if we receive a report and it's showing Vietnam, for example, that's already a mistake. It's flagged and we don't consider that report. The next thing is visual validation, where the expert looked at every photo of the snails that was submitted to identify if they have identify the correct species of snails, but also the number, because they had to also count for each of the species, how many individuals they had collected. So these were quick ways to validate the data. Although right now I'm not talking about it here, but it's important to maybe say something about it. Right now we're moving towards artificial intelligence, and there has been work already done based on the images that were submitted by the participants. We are now training a model to do this automatically. But what I should say is that over the period of time from 2019 to 2023, we have received over 6,000 reports from the citizen scientists. And I have good news. We have less than 1% mistakes in identifying the snails. And this is mainly because there was constant feedback between the citizen scientists and the expert. Also, we had annual refresher trainings. Those are good moments to kind of, talk about the challenges, but also to give more information about snails. And another thing we did to make sure that the data is reliable is we had experts going to the same locations where the citizen scientists collect data every month. While the citizen scientists collected data every week, the experts only went there once a month. And they had to do the same exercise, ideally, as what the citizen scientists did. And what we saw is we had similar trends in terms of presence, absence of the snails, and abundance as well. We see that in general, the trends are similar, although the citizen scientists report lower numbers than the expert, which of course should not be a big surprise. But the good news is that the trends are similar. We don't see any things that should be of worry. And moving on, some benefits that we realized with having a citizen science approach or having community members collecting data is that we have large-scale data, not only at the lakeside. When you talk about schistosomiasis, most people think about the lakeside. But what we noticed with citizen science is that you can be able to get data even more upland and unique data. For instance, in our project here, we had reports of snails that had not been reported upland. Also, we have information on risky water practices, and we see that there are also risky practices more uplands and not only just at the lakeside. So we see also people who are not close to the lakeside still engage in risky water practices. I think the big thing here is the cost. politicians will like this a lot. We try to estimate how much it costs to have citizen scientists collect data versus an expert do the same exercise. While we see that if we would have an expert do the same exercise every week, it costs us 8 times more. So it's 8 times cheaper to collect data with citizen scientists versus expert data collection. And this is just data collection. We have not included costs. We have not included the fact that the citizen scientists are empowered, the fact that there is a ripple effect in their communities. That is not, well, you cannot ideally easily put a cost to that, but this is just to show you the cost efficiency of citizen science. And I will hand over at this point to Maxson to talk about the behavior change, and I'll be probably joining back a bit later.
Right, thank you, Mercy. So we have heard from Mercy about what citizen science can do for snail control. So the next question that we would like to answer in this session is, what can citizen science do for behavior change? As you already heard, that prevention and control of schistosomiasis as one of the snail-borne diseases or NTDs is that we need the snail control, we need the behavior change, but also we need the preventive chemotherapy. So as far as behavior change is concerned, we also employed the citizen science approach together with other participatory techniques. So what did we do? What did we do in this answering this question? One, we first set out to identify the social and cultural risk factors associated with this disease. We wanted to know what are the community's level of knowledge, attitudes, and practices, and what do they perceive the disease to be? Do they think it's a dangerous disease that warrants prevention? And do they practice preventive measures? And what are the practices informed about? What about the health-seeking behaviors? So we conducted the study to inform the intervention. Next, we also used the results of these studies to co-design the communication tools. And then lastly, we conducted the community-led interventions that were taken, that were implemented in the communities, with the citizen scientists taking the lead. So when we conducted the study, we found actually that in the baseline study of the CAPS, we found that actually at least 30% of the communities would only avoid contact with water. That means that about 70% of the communities were not avoiding contact with contaminated water. And in this case, the major sources of water were the lakes and the rivers and the ponds around. That means that the level of risky practices was high. Although the baseline study also indicated that there was actually a high level of knowledge about the disease, the people could at least mention the signs and symptoms. They also knew the transmission modes. They also knew how to prevent, but taking the preventive measures was challenging. Another insightful finding that we got was that people were seeking treatment for those signs and symptoms from herbalists and also from churches. We also found stigma that was associated with the disease. When we interacted with some of the people that had suffered from the disease, there was also violence, domestic gender-based violence. There were also other social and cultural challenges that were associated with the disease, myths and misconceptions that were associated with this. Some people thought that it was a disease caused by witchcraft. Others actually thought that it was a disease only of the people at the lake. And others actually thought that the people at the uphill were not at risk of the infection. So armed with these findings, we then went back to the communities where we disseminated the findings. This is where now the citizen science engagement started from a social science point of view. We deployed the citizen scientists in the communities. They identified the key stakeholders in the communities. These were the herbalists, the religious leaders, the cultural leaders, the technical leaders, and also the political leaders at both village level, at sub-county level, and at district level. So we engage these stakeholders in dissemination of these findings to these communities. And we use data party where the participants were given these results, and they were able to go through with the citizen scientists taking a lead in interpreting the results and translating the results to some of those that could not understand the language. They were also able to demonstrate some of the findings, the key findings to the participants. We also then later on, after understanding these problems, we asked them now to prioritize and rank which of these problems were most pressing. And using those participatory techniques, the participants with the lead of the citizen scientists were able to identify key pressing problems. For example, open defecation, which was common, especially along the lake shores, and also risky water practices. So we see that the findings that the communities appreciated were also in tandem with the findings that we did, we found in the baseline study. There were a few other findings that the communities brought out, which were not in the baseline studies, which helped to augment the value of the baseline studies. So now, after sharing those findings, then we went back to the same category of participants. We said, now that these are the problems, how can we address these problems? Aware that there are many ways of addressing the problems, we interacted with the communities, with the participants, with the citizen scientists taking the lead, using the participatory approach of the World Cafe to find out how we can now create awareness about the disease. So using the World Cafe, the participants were able to now identify the key messages that needed to be passed to the communities and the channels that were preferred vis-a-vis the actors that needed to pass the messages, but also which kind of audience were appropriate for which kind of messages and for which kind of actors. So the citizen scientists took a lead in this, and that enabled us to come up with the goal of the communication and also the objectives of the communication, as we can see one of the citizen scientists presenting. After coming up with these communication tools, we again mobilized, brought in the citizen scientists and conducted training where we equipped them with the skills and knowledge on how to communicate to communities, to audience of diverse socio-cultural backgrounds, but also to communicate schistosomiasis messages to the communities in a contextualized manner. And also we gave them training on knowledge on how to mobilize. Armed with those skills and knowledge, and also with the tools, then we deploy them in the communities. So some of these are the channels that they proposed during the training, but also during the communication development. And the door-to-door campaign was one of them, where the citizen scientists moved to those identified homesteads, and then they were able to pass the messages that they already generated during the development of the tools, but also they use the same opportunity to post education materials like the posters, the flyers, and the brochures in the different public places, especially on the walls, on the door spots of the communities, and also churches and schools and hospitals and marketplaces. They were able to post these materials. One thing we should also note here is that the materials that they posted, we developed them with the information that was generated during the communication tool development. They also mobilized the communities, and when they mobilized the communities, then they were able to have community dialogues where they communicated the information about the disease. And community meetings were held, especially in public places where they felt people were able to come in big numbers. For example, along the lake shores, but also in markets or the roadsides, and also health facilities. They could mobilize. When they mobilized these communities, then they used the same time to also perform dramas. Dramas were performed by a group of people that were identified by the citizen scientists themselves, because these groups were known to be people who had ever performed in the communities. They are trusted and are believed to pass messages as directed or as guided by the citizen scientists. They also conducted football tournaments. Football tournament was used in this case to address the audience, the young population. The citizen scientists during the development of the tool suggested that if we want to pass a message about this disease to the young people like social gatherings and they like football. So the best is to organize football where it is used for mobilizing the young people. And then during that time, the messages can be passed. And indeed, we had a tournament, fixtures were drawn by the citizen scientists themselves in collaboration with the local leaders. And then at intervals, when the games were being played, they would stop the games, and then they would use the public address to communicate the message to the people that were watching the football. And also at the same time, they were passing the materials. Away from that, there were also others who preferred to use songs and dances to communicate certain information about the disease. And this they targeted especially like the communities in schools, but also the churches. They would use maybe the existing choir members of a particular church, and then they would use, give them the message, train them on how to pass the message about the disease. And then finally, they also recommended signages. Signages were the small signposts that were developed, and then small writings, sensitive writings were labeled on them, and then they were placed at hotspots, especially for open defecation. They would place them on areas where they felt there were common open defecations along, and also where people were fetching water, maybe in areas that are contaminated. So they would put those writings that don't defecate here, go and defecate in the latrine, or don't fetch water from this spot, go and fetch water from the borehole. So that in a way, whenever a person would come around those signposts and would read them, and then they would be able to get the message and then do the right thing. With that, they were able to reach at least over 20,000 people in the study site. And when we finally did an inline study, we found one of the key benefits of this citizen science engagement was that, as opposed to 73% of the people that felt that it was not important to avoid contact with the contaminated water, when we did the endline survey, at least 91% said it was really important for them to avoid contact with contaminated water. At the same time, when we interacted with the local leaders, we asked them what they felt were the benefits of this engagement. They said that as a result of the awareness, they were able to identify some of the challenges that they had and also the resources that they had. For example, the boreholes that had broken down, they used the opportunity, the knowledge, the experience of the awareness to identify those places and also garner resources. And then they were able to repair as many boreholes that are broken as possible, that they were also able to create and establish bylaws to govern the operationalization and management of those boreholes. I think my colleague Mercy will carry on with how we think citizen science generated data can be used for policy. Mercy, you're welcome.
Yes, as we wrap up this Knowledge Cafe, we also were wondering, we have in the first section.
Mercy, we don't, excuse me for interrupting, we don't hear you so well, so maybe just lean forward a bit. Thank you.
Is it better? Do you hear me now?
A little bit, yeah. Hopefully it will click in. Okay, go ahead. Thank you.
All right. No, okay. As we wrap up, we also were wondering, because we have over 6,000 reports about the citizen scientists, but will this be used by policy actors? It's such a big question we had. And so for that, we spoke a bit with relevant policy actors, and we are happy to report that more than half of them have high trust in citizen science collected data, because in any case, they also rely on community members to inform them, at least to get primary data. We also saw that a third of them had medium trust, which implies that some terms and conditions applied, and these were stipulated. And we still had some who doubted that citizen-generated data can be used. Apologies, because I'm in a shared office. I don't know if you can hear me very well, but I'll carry on. So another reason for trust is mainly based on data and participant credibility. These are key factors to enhance trust amongst policy actors. If you have trained participants, like we did in ATRAP, we trained the citizen scientists before we deployed them for data collection. And also there is evidence to support the data in form of the pictures that they took. This actually really builds trust among the policy actors. And so to mirror that, if your data is questionable, there is no evidence, you have incompetent participants, then the trust definitely goes down. And as I really I also conclude, we were curious to find out from them what strategies can be put in place if citizen science generated data will be used to inform policy or decision making. And at the center of all the strategies that were laid by the policy actors was involvement of them. Actually, their involvement in the initiative was very key. It should be at the center, and their involvement comes in brings three advantages. I'm sorry. The first advantage is the community entry. By involving policy actors or leaders, you have a smooth policy entry, but also you can be able to contextualize your objectives and recruit participants like we did in the ATRAP project. The second is they can be involved in, for instance, supervision and follow-up of the participants, and that way you support the network. And lastly, they can also be involved in evaluating impact, verifying the data, if the data is actually a true representation of what is on ground or not. And with that, to quickly just give you a wrap-up of what the ATRAP Citizen Science Initiative was set up. First, you have to recruit community members, and this we did in collaboration with community leaders. We actually asked them to identify participants that are trustable in the community, participants that are residents there, people that can read and write. There was a minimum criteria that was put in place. We trained and equipped the community members to collect snail data. They had protective gear. They had equipment, the snail scoops and smartphones also we provided, because most of these locations are remote and people do not, in most cases, have smartphones. We also had data validation to ensure that our data is reliable, it's scientific, and can be used to have meaningful scientific outputs or interpretations. We also did a quality check by involving an expert. So citizen science does not mean that the experts completely disappear from the picture, but the citizen scientists actually only complement expert observations. Also, we had participatory dissemination of results. After we had the CAP survey and all these results, we involved the citizen scientists and their communities to send back the results to them. And there was co-creation of community communication tools. There were brilliant ideas coming from the communities of how we can communicate this information, which I believe scientists working alone would probably not have been able to think about. And finally, we had this community-led outreach where the citizen scientists were at the forefront, raising awareness about schistosomiasis and not the scientists anymore. So people in the communities were hearing about schistosomiasis and its dangers and how to prevent it from their brothers, uncles, aunties, from people that they are familiar with, and not the experts coming from Lira University or from wherever, from Belgium, to speak to them about schistosomiasis. It was by someone that they are familiar with. And with that, we come to the end, and Maxson will close. Thank you very much.
Thank you, Mercy. And so as we conclude, if you have forgotten all that we have said, at least don't forget this, that indeed citizen science can simultaneously increase the monitoring capacity and public engagement in vector-borne disease, for example, like schistosomiasis. Indeed, we see that citizen science really can give us unprecedented data in terms of the spatial temporal resolution. This data is huge, and it is also something that expert scientists themselves maybe cannot do. Next, we also see that citizen science data generated really is comparable with that of the expert. That means that we can now then trust the data. If we have problems of money and time, we can actually use the communities themselves, because we can generate a huge volume of data that we can trust. Also, another thing that we see from this approach is that it creates ownership, that the citizen scientists, the communities themselves take a lead. And in this taking lead, it means that they trust what they're doing, they understand what they are doing, and because they trust and understand what they are doing, they own the problem themselves, not the problem being imposed to them. And if the problem is owned by them, that means the solution is also owned by them. And so we see aspect of sustainability being addressed in this. As we say, our problem, our solution. And then lastly, we see that citizen science generated data can help in generating or in guiding policy formulation, but also policy action, and also local action and generation of laws that can govern local operations in the prevention and control of NTDs. I think we want to thank you, but one thing that we should not forget when we are doing citizen science is that the selection process should be done in a more engaging manner as possible. Engage the communities, engage the different stakeholders when selecting these volunteers, because the volunteers should come from the communities. The criteria for the selection should be vetted by the communities, and also the people themselves should be the people that are known and trusted by the community, because at the end of it all, the communities are the ones that are going to take a lead in this. And also continuous communication, the back and forth communication between the experts and also the locals, and also between the local leaders and also the citizen scientists, and between the local leaders and the experts. So there's that engagement that has to continue, give back and forth communication, giving feedback on what the challenges they're facing, and also the outcomes and the lessons that they have learned so far, and the activities that they are doing. This kind of back and forth communication is very critical for the success of the approach. Thank you very much.
Thank you so much, Mercy and Maxson. That was absolutely fascinating. And thank you both for sharing those perspectives on the study that you did. So we have a couple of questions that have come up in the chat. So I'll go ahead and and I mentioned to all attendees, if you want to directly ask your question to our speakers, please put your hand up, and I'm very happy to call on you. But we do have a question. We have two questions that are kind of related about sustainability. And it was actually one that I wondered about as well. So I wonder if you could speak a little bit about, now that ATRAP is, concluded, this approach, one would think, really leads to more sustainability, but it would be interesting to hear your perspective on that, and how you think the project will be sustainable and the work that you've done. So we'll start with that question.
Yes, can I come in?
Yes, please, go ahead.
So I want to first address myself to the issue of sustainability in terms of volunteer loss in and replacement. And as Mercy already first indicated, I think I saw there a question about whether if a volunteer left or for one reason was out, how do we deal with it? Indeed, we had 25 citizen scientists that we actually recruited, but in the actual sense, there were 75 volunteers that were nominated by the communities, with the 50 remaining as a standby. And this was to also ensure sustainability, so that in case any volunteer left, dropped out for any reason, or either migration or lost interest, like the participants asking, inquiring, then we would just pick up from the list. And this 50 or 75 in total were people that were recommended by the communities. They knew them and they trusted them that they would do work. Every one of them actually would do work, except at that time we only needed the 25. And indeed, in the experience of the ATRAP, there was, along the way, there were some volunteers that left. They changed their places of abode, and indeed we just had to pick from the list that we had, and work kept going on very well. And then for the general sustainability of the project, yes, there's an ongoing discussion about how this should be done. One of the ways that we have discussed with the communities is about how we can integrate them within the healthcare system, or combine them with the village health system that is working, so that whatever the citizen science approach is implementing can now be integrated within the village health team that the government is implementing. I think Mercy can add one or two more.
Yeah, I'll just add that what we noticed also, what I think what was interesting for me is that we had 25 people collecting data, but oftentimes they trained their family members as well. So there is like this ripple effect going on. We had many citizen scientists, not former, but they were there. So there was, yeah, a ripple effect going on. So I think in terms of sustainability, that is what we envision somehow, that there will be a ripple effect of having one citizen scientist and then they train their wife or their child. Also, we had cases where people said, oh, I forgot to collect data and my children reminded me that I had to go to the field. So that's what we had in mind. And I'm glad to say that this kind of things are happening there. This is what I'll add, but I think Maxson said it all.
I really appreciate that comment. And I think it's one of the challenges we often have in research and also in projects is capturing those ripple effects, you know, the things that you don't intend to happen that are really important and amplify the effect of what you're doing. So I love that story. It makes me wonder if there's a role for school children in this sort of thing. So we have another question from Addie. Was there any kind of incentive given to the community scientists to participate in the research, or was it fully voluntary? So maybe we'll start with that question and then we'll go to the second one afterwards.
Yes, we should say this is as opposed to citizen science in the global north, where people just come and volunteer. In the global south is a bit tricky. Even when they have the volunteering heart, the commitment, still you need to push, you need to compensate for their time, you need to provide for example, transport to allow them to move from point A to point B to go and monitor the snails. That does not necessarily mean that it is because of the incentive that they were able to work, but yes, there was some minimal incentive that was provided to compensate for their time, to compensate for their small monies that they had spent maybe in going to monitor the snails, in going to do the mobilization. Some small financial incentive, but there were also other incentives to do with the equipments that were given to help them to do the work appropriately. Thank you.
Actually, I'll just add on to that because it's part of what I'm doing for my study. To find out what is driving them to participate, because and it's interesting to see that the changes. What I should also say is that when we were recruiting, we did not talk about financial compensation, for instance. So at the start, it was really, we have this idea, we want to reduce snail-borne diseases, who is in, who is out. And that way, people only learned about the financial compensation once they were on the project, but also it's a compensation, and we are very keen to call it a compensation. So it's not a salary, we just provide a reimbursement if you have to worry about your next meal and also transport money to go to collect snail data. That might be a conflict of needs there. So we compensate for their transport, we compensate for the money they need to buy an internet connection, because while the COBO toolbox is an open source, you still need an internet connection to send the data. So most of them ideally don't need the internet connection for their daily lives. So because we ask them to help scientists, then we kind of foresee this. But I also like to ask scientists, and if they're here today, is as a scientist, do you collect data out of your pockets? And I don't know what the answer will be, but then I'll go on to say, why then would you expect community members to collect data out of their pocket? But that's food for thought for scientists who are on this platform here. Thank you.
Very fair question, Mercy. Very fair question. And I like the approach that you took, you know, that the compensation, you know, the way you phrased it, and also, you know, the reason why you provided it to help them offset some of the costs that they might incur, opportunity costs as well as financial costs. So the second question that came in was, how long did the mapping last?
They collected data since, well, the project was launched in 2019, and I think immediately we started about 2020, COVID happened, and there was a bit of a break. But what we found, at least what I found from my study as well, was the participants, the citizen scientists still were able to collect data, and that was such a big incentive for them because they were now given new names like Doctor of Water, and in one of the interviews that I conducted with them, they specifically say even during the curfew, I could still go to collect data because the policemen or the people in charge of security to handle curfew knew my work, and so they still let me go to collect data. So they've been collecting data since 2019 until last year, 2023. That has been going on. Just to go back to the question.
Yeah, that's excellent. And it speaks to that, you know, the recognition and empowerment of individuals in their community. It's really wonderfully demonstrated by your remarks. There was another comment on or question, what was the ratio of male to female participants?
Maxson, you want to respond to that?
Yes, the ratio of female to male participants was interesting, I should say, but it's not strange, it's not surprising. We had, I think, 7 female citizen scientists versus 18 male citizen scientists, which is, I think, it's good, I should say.
It could be good if you compare it to Congo, where the females are even fewer. But in general, we tried to aim for gender balance, but that we did not manage to achieve this. Although I think, given the situation and the context, we were pretty happy with what we received. Yeah.
Yeah.
And I suspect that may reflect gender roles and responsibilities probably in those communities. Yeah. Okay.
Yes.
I had a question on, you mentioned, I think, Maxson, in your presentation on gender-based violence related to schistosomiasis, and I wonder just kind of if you could speak a little bit more to that, and was that related to the beliefs around witchcraft, or I'd just be curious to understand a little bit more about that comment that you made.
Yes, so one of the baseline studies that we conducted was to understand the lived experiences of the individuals in the communities that had ever suffered from the disease. And one of the stories that really touched me about the gender-based violence that came in was that the females, this happened actually both sides, but I would like to focus especially now on the females. Some of the women that we interacted with, the female participants that we interacted with, they said that when they found that they had the disease, when they started experiencing the disease, of course it presents with signs and symptoms, some of them synonymous with other conditions, for example, HIV/AIDS, which is something which is stigmatizing in the global south, as some of us know, but also because it is also associated with the promiscuity. Some of the practices, for example, if you start having rashes and they suspect that you have HIV/AIDS, they think that maybe either the man or the woman has been practicing promiscuity, has been promiscuous. And so it brought in the issue of violence, because the man then would start beating the woman that you went outside and brought a disease in her house. Now you have infected me. And then some of the men, actually, the women say that their husbands abandoned them, they ran away, because now they felt that the whole responsibility of taking care of the house was a challenge. Then at that time, when now they felt that their wives were infected, because they said, now my wife has HIV/AIDS. Now I have to take care of the child, and the woman, I have to take care of the children. I have to look for drugs. So some of the men beat their wives. Others actually ran away. And one of them actually also about the men now. One of the men said that he actually was forced to do HIV/AIDS test 32 times by the wife, because each time he presented with the signs and symptoms of schistosomiasis, the woman suspected him to have acquired HIV/AIDS and would force him to go for the HIV test. And in all these instances, it was negative. And it was in the 33rd test when they went together and it was found to be schistosomiasis. That's when the woman believed him, and peace came back to the house.
So the role of education is super important in
Very,
this.
very important.
Yeah, no, those are really important stories. We have one more question that's come in around gender again, and this is from Ines. What measures were taken to try to reach the gender balance? I think Mercy, you alluded to that you tried to do that, and did you carry out any? Did you carry out any evaluation of the measures taken to determine what worked and what didn't in terms of the gender balance?
I would go maybe as Maxson thinks. I think that's a bit tricky because with ATRAP, our community entry strategy was to really go through the community leaders. So we as the ATRAP leader members, we don't know these communities. First of all, we don't live there. So in a way, we strategized to go through the leaders. And so while we drafted criteria together, the rest of recruitment and nomination was handled by the community leaders. We are yet to evaluate the project also as a whole. Maxson, you will correct me in this, but in general, just to give you a background, we relied on the leaders for selection of the participants, and we have no hand in it apart from the criteria setting.
Yes, just to add on to that, indeed, it was a bit difficult to ensure that we have a gender balance at the point of recruitment was a bit difficult. What we only did was to ensure that we had a minimum criteria, that criteria was vetted by the communities themselves, and they agreed that this criteria were okay for them. So whoever came on board was really successful because the communities knew that these criteria were okay. And indeed, what we only did was to ensure that any female member that came on board that now met this criteria was really maintained and retained and ensure that we protected the gender aspect. And how did we do that? We ensure that we took into account how the gender roles play in terms of task allocation, but also ensure that we maintain, we engage the spouses, the leaders, to ensure that these people were accorded the privilege that was due to them so that they're able to perform their role vis-a-vis the male counterparts. So yes, at the entry point, it was a bit difficult, but once we got them, the few that we got, there was, I think, the very minimal loss rate for the females compared to the males. Thank you.
Thank you. And I think, it's always, you're speaking really about this balance of really taking the recommendations from the community and then what we as researchers want to impose, right? A 50-50 gender balance. And yet the community, it's a delicate dance, isn't it? And you have to go with the recommendations of community as well. So it is, I think you're illustrating some of the real challenges on that. So we have one time for one last question. There was a comment that female genital schistosomiasis in this community, if it's a hematobium infection, might be interesting to provide awareness on that. And that was a comment that was made, which I think is a good one, if it is indeed an area of hematobium. The last question that we can take with the time remaining is it's interesting on the signs that say do not fetch water here or do not urinate or defecate here. Are there easily available options for both? So if you don't fetch your water here, can you go somewhere else? Or not urinating or defecating here, are there latrines available? And this individual says, comparing to one of our study regions in Zimbabwe, this would not have been fully implemented due to the lack of wash facilities. So just wondering, I thought those signs were really interesting too. Were you able to direct people to boreholes or to latrines? If you could just comment on that, please.
Yes, so I think this is a very valid concern raised, and in fact, I should say that's one of the things that is taking us to the phase 2 of the project, that's addressing the wash aspect, the water and sanitation. But nonetheless, let me add here that when we came up with when the citizen scientists came up with that suggestion, there were at least some facilities that they thought were available. Actually, they felt that the communities could use, even though the facilities were not adequate enough, but at least they felt that other than going to, for example, to defecate in the open place or in the lake, at least the few that are available should be used. Because it also has to do with the myths and misconceptions. So not defecating in the toilet is not just about the absence of it, but also some of it is about the myths and misconceptions surrounding the utilization of the facility. So the saying that don't defecate here, go and defecate in the latrine, did not in itself imply that all the latrines are there and therefore everyone should go there. No, indeed, there are problems of infrastructures of latrine, but there are at least some latrines that you would refer people, who would recommend people to use, that then would be better than going to defecate in the open. The same with water. Yes, the lake communities have challenged with the access to clean and safe water, but then during the awareness raising, the communities were being encouraged, for example, to boil the water, to fetch the water and put it to settle, and also to access the boreholes that are around, even though they are expensive, or to use water guards to purify the water, and some other activities, preventive measures that were recommended during the community outreaches. So in a way, they're trying to say what you are doing is really the extreme of the risk that you are putting yourself to. And so that was really critical. Thank you very much for that observation.
So thank you both. Oh, Mercy, did you want to add one last thought on that before we?
No, not really. I just wanted to comment on the female genital schisto that we have done work on that in Congo. It's not really something that myself or Maxson has done, but I know that a team member of ATRAP has done work on female genital schistosomiasis in Congo. And there is a publication to this, Maxson, you'll correct me. Yes, I think there is a publication to this.
Yeah.
Excellent. Perhaps you can put it in the chat, or we'll include, or send it to me, Maxson, and we'll include it with the details on the Knowledge Cafe. So I would just like to thank you both for such an excellent session. It was wonderful to hear what you're doing, to hear this example of citizen science being used. I think it's a wonderful example. We'll look forward to the evaluation and the publications coming out of this. No pressure. But I think it's very, very exciting, and really the direction that we want to go with empowering communities more. And I love we didn't get to talk about it, but the reference that you made to trust was so important, and on so many different levels of trust. So I just want to thank you both for your time today, and wish you well as you continue this work. And we'll look forward to hearing more about it as the project moves forward. So thank you so much. For those of you who are online today, we thank you for joining us for the Knowledge Cafe. As I mentioned at the beginning, ICORDS is open for anyone to present their research, their ideas, new techniques that you're using. This is a forum that we like to use to hear from members of our own community. I would invite you all to join ICORDS as members. It is open to anyone who is interested in neglected tropical diseases and the intersection with social and behavioral sciences. So you're all welcome to join. We will have our next Knowledge Cafe in April, and so stay tuned for more information on that. I would also like to remind you of the mentorship program that's currently ongoing in ICORDS. This is our third year, and we are asking for mentors and mentees to apply, and I've put the form there in the chat. So I like to say that anywhere, at any point in your career, you could be a mentor, and at any point in your career, you can be a mentee. So I would encourage you to apply to that. And it's closing soon. So please go ahead and apply. And we'll look forward to seeing your applications and seeing you hopefully on the next ICORDS Knowledge Cafe. So Mercy and Max, once again, thank you so much.
Thank you. Thank you.
Thank you for having us too. It was,
yes.
Yeah, it was a brilliant session. Thank you.
Wonderful. Yeah. And I'll have a good afternoon in Uganda. Take care.
Yeah.
Bye. Bye.
Thanks everyone for joining.
Thank you too.
Thank you.